Okay, welcome back guys. I am Dr. Kalim Raza. Today in this video lecture we are going to discuss about the facial palsy. The Bell's palsy, this is one of the most important topic in the neuroanatomy. And facial palsy, this is one of most common palsies in the world. Basically, these facial expression muscles are innervated by basically facial nerve. So if you are touching your face, you are feeling the sensation. This is basically sensory function, and this is function of the fifth cranial nerve, trigeminal nerve. But when you are closing your eyeballs, these forehead wrinkles, yes, you are asking the patient to basically show the teeth like this. So these all movements of the facial expression muscles, these are controlled by your facial nerve. So facial nerve palsy is common in case of the stroke, in case of injury to your brain, or in case of the injury to the level of the pontomedullary junction, because this facial nerve, seventh cranial nerve originating from pontomedullary junction. So any lesion at the pontomedullary junction or stroke of the upper brain or anywhere along the pathway or the tract of this nerve, if there will be any tumor or demyelination in case of any chronic disease like diabetes, or compression of or entrapment of this nerve in any bony channel through which this nerve passing through, it lead to basically denervation of the facial expression muscles. So this is very important topic. Stay with me please. So first of all, focus on this structure here. You can see in this structure, as you can see this is basically corticobulbar tract, the facial nerve tract. Here this is upper vein and this is lower vein. Okay, let me please highlight. Let me highlight here. You can see this is the lower vein of the facial nerve, and this vein is coming only that innervates to your lower face. So lower face, this is the tract which innervates to your lower face. But in case of forehead, here you can see that this is innervation to your forehead. So forehead is having bilateral upper motor neuron innervation. So bilateral upper motor neuron innervation is only to your forehead, and lower face is innervated only by one sided. You can see this is a lower face innervation. So what happens that if any person is having stroke, this is, and that stroke is basically upper motor neuron lesion. So in case of the stroke, as I have told you that your forehead is having dual innervation, that forehead is having upper motor neuron from both sides, but lower face except forehead is having single sided innervation, remember please. So what happens that in case of the stroke, and most common stroke, as we know that most common stroke are the strokes of the MCA artery. So in case of the stroke of MCA artery, if person is having stroke of the right MCA artery, as these fibers are crossing each other, so only this contralateral lower face will be affected. So it's like this, let me draw this X. Understand please. So suppose this is injury to right sided brain, and this is the brain here. This is upper motor neuron injury. Upper motor neuron, it's in stroke. So this patient is supposed having stroke of the right MCA artery. So what happens in case of the right MCA artery? This is the lower face. This is the lower face which is affected. This is contralateral. So imaginary, you can draw one X like this and like this. So if I am having stroke of the right MCA artery, my this face, left sided lower face will be affected. Upper face, forehead is spared. Why it's spared? Because it's having dual innervation. Here you can see on the red marked arrows that I have highlighted, that in case of the stroke, in case of the blockage of the MCA artery, in case of the any lesion to the upper brain, your only contralateral face will be affected, but not complete half face, only lower part of the face. Forehead is spared. Why forehead is spared? Because forehead is having dual innervation. I hope you understood. So if person is having left MCA stroke and this is contralateral, this lower face will be affected, forehead is still spared. But when suppose person is having injury along the tract of the facial nerve, here you can see in case of the lower motor neuron injury, in case of the injury at the level of the pontomedullary junction where this nucleus of the facial nerve lies. Number 2, anywhere along the tract of the facial nerve. Here you can see this is lower motor neuron, this is the peripheral, it means along the tract of the facial nerve. So what happens, that it means that there will be complete denervation of the one-sided face. So suppose one person is having injury to the right side of the brainstem, tumor of the right side of this pontomedullary junction, or any lesion or entrapment of this facial nerve along the tract. So it means this is injury of the lower motor neuron. In stroke, that is upper motor neuron. Anywhere along the pontomedullary junction in brainstem or along the tract, this is called as peripheral nerve lesion, and this is called as lower motor neuron injury. And in lower motor neuron, here you can see both upper and lower face is denervated. So guys, remember that in case of the lower motor neuron injury of the facial nerve, this person is having injury on the right side, it means there will be ipsilateral problem, that I am having problem on the right side of this pontomedullary junction. My right face will be denervated. So if suppose I am having right sided facial palsy or Bell's palsy, and due to injury of the lower motor neuron, and you are asking me to close the eyeballs, normally if you are asking me to close your eyeballs, I can close both of my eyes. This is because of orbicularis oculi muscle that help in closure of the eyeball. And if you are asking me please show the teeth, I am doing like this. Normally my facial expression muscles are working properly. But if I am having this right sided stroke of the pontomedullary junction, brainstem injury, lower motor neuron injury, and you are asking me please close the eyeballs, so it's like this, I cannot close my right eye. It means right sided I am having facial palsy and this right lower motor neuron injury, and you are asking me please show the teeth, so it's like this, I am unable to move this side. So it means patient is having problem in the right side pontomedullary junction. So remember, if left side, it will be denervation of the left side of the face. So there are common personalities who are having this facial palsy. This is very common, especially I have told you because of demyelination, but most common cause is the unknown cause, and this is called as Bell's palsy. This is because of one scientist on the basis of his research work, we are calling this as a Bell's palsy. He was Charles Bell's, I think, if I am not mistaken. But anyway, you have to understand that Bell's palsy is very common palsy, and most common cause is idiopathic, like in trigeminal neuralgia also. But trigeminal neuralgia, that is a entrapment of trigeminal nerve, and in facial palsy you are having problem with the facial nerve. And recently I think very famous singer Justin Bieber, he was planning to have one concert in India, New Delhi. He cancelled because of Ramsay-Hunt syndrome, and in complication to Ramsay-Hunt syndrome he was suffering from the Bell's palsy. So you may research about this Ramsay-Hunt syndrome, which is another cause of the Bell's palsy. So guys, let me discuss further about this palsy, because this is one of the hot favorite topic, and you will definitely have one question in your exam, and we have to discuss that how you are going to make diagnose and how you are going to treat this palsy. Here you can see in this picture. So this lady is having facial nerve palsy. So this side of the face is affected, no impressions, and this side is okay. You can see you have expression on this side, so it means she is having problem on this side. So this is probably the lower motor neuron injury. This is probably when you have complete half face, it means this is lower motor neuron. If contralateral only lower face forehead dissipate, that is upper motor neuron injury. So Bell's palsy, this is most common cause of peripheral facial palsy, usually develop after HSV, herpes simplex virus reactivation. Treatment, yes, treatment we are using antiviral acyclovir, or we are using this steroid like prednisolone. We are starting from 50 mg probably, and we are using for 2 weeks. Slowly we will taper off. So best treatment is physiotherapy, like we are asking patient to chew the gums, to move the facial expression muscles, or to inflate the balloons, yes. And then we are using painkillers also, NSAIDs, or we are using steroids. So most patients gradually recover the functions. but other causes of the peripheral nerve include Lyme disease. Yes, this is another cause of this palsy. Other Ramsay-Hunt syndrome. This is what I was telling you about the Justin Bieber. He was having basically Ramsay-Hunt syndrome, so he is also having Bell's palsy. Or sarcoidosis, tumors like parotid gland tumors also lead to this palsy. Or the diabetes, guys, remember this is very common nowadays. So whenever you are having any patient who is suffering from peripheral neuropathy, you should not skip this. Probably there will be this cause. This is a leading cause of demyelination of the nerves, peripheral neuropathy due to complication of the blood vessels, due to complication of vascular structures. So diabetes, this is another cause. Next, let's discuss that what will be the features in case of injury to the upper motor neuron, that I have already explained, the lower motor neuron. So what happens, upper motor neuron lesions, that patient is having injury anywhere along the motor cortex here, anywhere along the motor cortex, or connection from motor cortex to the facial nucleus in the pons. So above the pons, if person is having injury, it means it's injury of the upper motor neuron. You understood? Now next, affected site will be contralateral. So if person is having injury above the pons in brain, most probably the MCA stroke. If right, it means contralateral only, lower face will be affected and forehead will be spared. This is what written here. And muscle, which muscle involved in case of this upper motor neuron injury? Lower muscles of the facial expressions, but contralateral. This is what I have just explained, that if you are having injury on the right side of MCA artery, this left sided contralateral lower face will be affected and this upper forehead is spared because upper is having dual upper motor neuron innervation. And forehead, it's written here, forehead is spared due to bilateral upper motor neuron. Other symptoms variable and it depends on the size of the lesion. So next, what happens in case of the lower motor neuron injury? Lower motor neuron, it's mean at the level of pontomedullary junction or anywhere facial nucleus, anywhere along cranial nerve number 7. Problem will be ipsilateral or contralateral, guys. This is, I have mentioned already, problem will be ipsilateral. Anywhere mentioned with the lower motor neuron, problem will be always ipsilateral. Okay, ipsilateral means same side. Ipsilateral means same side of the lesion. So if problem in the right pontomedullary junction, problem will be the right face, and both upper and lower muscle of the facial expression is affected. Remember, both upper and lower. Forehead, yes, it's affected also, forehead is affected. And what are other clinical features? That incomplete closure of the eyeballs, dry eyes, corneal ulcerations, hyperacusis. Hyperacusis, why hyperacusis? What is hyperacusis? Hyperacusis is basically intolerance to certain sounds. This is also denervation to the stapedius muscle. About the stapes, incus, malleus, the bones in the internal ear, which transmit these sound signals. So denervation of this stapedius muscle, sometimes you are having tinnitus also, or hyperacusis, it's been intolerance to the certain sounds. And loss of taste sensation from anterior 2/3 of the tongue. Why anterior 2/3 of the tongue? Because anterior 2/3 of the tongue, this is the taste distribution is carried by chorda tympani, which is branch of the facial nerve. So guys, you have to watch this lecture. This is very important, and you don't forget to make your notes. Stick with us. See you next lecture. Thank you.